Good morning, everyone. Today we are reporting 59 new cases of COVID-19 in the state. This will add a total of 58 to the total case counts due to one individual case being deduplicated in our case counts, in our case data, excuse me. In total, we've had 6 new hospitalizations, 0 new deaths. We have 37 newly recovered individuals, and we've had over 1,091 new tests that have been performed. This does bring our total case count of COVID-19 in the state to 9,663. Of those, we've had 1,146 that are considered active infections, and that's due to a little bit of an increase of our cases over the past few days. And we've had 8,371 individuals who have been considered recovered and are no longer able to transmit COVID-19. We have 63 individuals who are currently hospitalized, and in total we've had 146 deaths. In terms of the total number of tests that have been reported to the South Dakota Department of Health, we have 153,507, and that does include 121,477 unique persons who have been tested. We have no updates for our community impact map, and I'll go ahead and give the update for our clusters. From McCrossen's Boys Ranch, we've had 16 recovered out of the 37 cases. For Camp Judson, we have 81 recovered out of the 96 cases, and that is our update for clusters. For the long-term case update, I would like just to remind individuals that residents of long-term care facilities, which includes our nursing homes and assisted living centers in the state, are at greater risk of COVID-19 due to their older age as well as presence of chronic conditions. The Department of Health actively works with long-term care staff to prevent COVID-19 infections from occurring, promptly identifying cases when they occur, and implementing testing and control measures. So in total, we have had 542 cases among our residents and staff at long-term care and assisted living centers, or excuse me, at long-term care facilities in the state. That information is as of August 5th. In comparison, the total number of cases among U.S. residents in long-term care facilities has been 165,055 cases, of which 43,231 individuals have died, and that is the national numbers. We have had in South Dakota the breakdown of those 542 total cases that we've seen. 299 of them were residents, and of those, 65 deaths have occurred. That does mean that among the deaths that we had as of midweek last week, long-term care residents accounted for 48% of all deaths. On the staffing side, we have seen 243 staff identified with COVID-19 infection. Just to show a little bit of some of the differences around both our case rate as well as our death rate. So South Dakota ranks 5th lowest in terms of our case rates with 20.3 cases per 1,000 residents. And this is in comparison to New Jersey, which stands at the highest case rate at 359.2 cases per 1,000 residents. For the death rates within those long-term care facilities, South Dakota has a rate of 4.7 deaths per 1,000 residents, and that compares with Massachusetts, which holds the highest rate of 124.0 deaths per 1,000 residents. It is important, we do want to highlight the importance of testing within our long-term care facilities, and so Department of Health does support sentinel testing of long-term care facility staff and residents. In addition, when a case is identified within facilities, we work with those long-term care centers to make sure that they conduct point prevalence surveys of all staff and residents, One of the other pieces to highlight the importance of testing within long-term care facilities is that there is a antigen testing platforms that are being over the next couple of months being submitted to all long-term care facilities within the state of South Dakota, as well as other state jurisdictions. So eventually those long-term care facilities will have the capability of doing their own testing and won't need to seek outside entities to do that. So with that, I'll turn it over to Secretary MALSAM-RYSDON.
Thank you, Dr. Clayton. Thanks, folks. I just wanted to provide a brief update on where we're at with some of our mass testing efforts. You'll recall that we did do mass testing of all nursing home and assisted living residents and staff, and that has been completed. We are still continuing to work with congregate setting facilities across the state. 11 out of 15 providers have completed that testing as of this date. And of the 779 individuals tested in that round, 22 were positive, so that's a positivity rate of 2.82%. Of those positives, 18 were residents of those facilities and 4 were staff. In addition, we've been working to do mass testing among the emergency medical service provider group, starting with West River, and offering that mass testing prior to tourism season and large events happening out there. As of this weekend, we've been able to complete testing for the following EMS services: Apollo, Faith, Hot Springs, Deadwood, Sturgis, and Edgemont. All of the test results for those EMS providers have come back negative. And you might recall that our plan is to do additional mass testing of EMS, law enforcement, and firefighter personnel statewide starting 2 weeks after the Sturgis motorcycle rally. So that concludes my update.
All right, I'll go ahead and unmute our lines, and then we'll take your questions. We're ready for your questions.
Yeah, JP from KOR and News Radio.
We'll go to JP.
Thank you very much. I've noticed it seems that we are on an upward trend with the number of hospitalizations. It was at 31 on July 31st and now has doubled as such. Do you have any concerns about that or any idea why?
So that is a good question, and one that I'd like to highlight is that we have seen some increasing number of cases within the past week or so. And so what has been highlighted in national data as well as other states is that there is a lag of 1 to 2 weeks from the time when individuals are first identified as cases to seeing some additional increases within hospitalizations. Individuals with COVID-19 tend to have more severe symptoms starting about day 7 through 10, and so that's a little bit of just how the infection works with that severity increasing even after symptoms become apparent. And so I think that's a little bit of what we're seeing is that delay in hospitalization following some of the increases that we had seen previously.
JP, this is MALSAM-RYSDON. I would also just remind folks that, that's a number that we will continue to watch very closely and work with our healthcare partners on. But even at the rate of hospitalization that we see today, we have a lot of capacity left in the system and a lot of open beds to take care of folks.
Thanks.
Next question.
This is Lisa with the Argus Leader.
Go ahead, Lisa.
Have there been any cases connected to the Huset's race event or the Sioux Empire Fair?
So at this time, we're not aware of any specific cases that have been identified at those locations. Again, we do focus on making sure that when there is transmission occurring, that we're not able to when we're not able to notify individuals who have been close contacts, that we do public notices. So just wanted to make sure that folks are reminded that the Department of Health would issue a public notice if one is needed for those locations or for Sturgis Rally or other sort of large events.
Next question.
This is Morgan at the Rapid City Journal.
Go ahead, Morgan.
Can you talk about the mass testing plan for K-12 schools and universities, and maybe where, like what kind of machines the universities will get to do the testing through the semester?
So, Morgana, a couple of things there. So, public universities in South Dakota all have Abbott ID Now machines that they can use on their campuses, really geared towards people that are symptomatic, is really the best use for those machines. They are, depending on the university, working on different testing plans, kind of consistent with the schedule of activities that they will have, and using testing as one strategy in their overall response plan. So it really does vary by university. For K through 12 schools across the state, the Department of Health is offering to help them with sentinel testing, which is randomized testing of asymptomatic adults that are working in those settings. And so sentinel testing, you might recall, is something that we're also doing with long-term care, and again, it's meant to determine if there are cases of COVID in that type of a setting where the person is not showing symptoms, and so it's kind of a preventative type of testing that way. So we are working with schools on that. There will be an enrollment process for them to indicate if they'd like to participate in that, and we're working with the Department of Education on that part. And for schools that do elect to participate in that, we will be providing the supplies and the testing materials that they need, and then conducting the actual tests at the South Dakota Public Health Lab. We anticipate that we will start to get schools enrolling here within the next week or so, and so we'll have some updates at a future date in terms of the numbers.
Next question.
Todd Epkello.com News.
Go ahead, Todd.
Thanks. Wanted to kind of tie two different health issues together. Earlier this year, before the coronavirus hit, the State Department of Health and the governor was big on the Meth We're On It campaign, and that was viewed as a major health concern in the state. And then the coronavirus hit. What impact has the coronavirus and your response, the department's response to it, has had on the meth response?
So, Todd, this is Kim MALSAM-RYSDON. The meth prevention campaign and treatment is handled through the Department of Social Services, and so where the Department of Health really comes in is providing data around, substance abuse and deaths related to substance abuse, and we continue to do that work. I can tell you that preliminarily we are seeing a higher rate of deaths from drug overdose this year, and that's a higher rate. Of course, that's provisional, so we don't have a full year's worth of data, but so far this year we are seeing a higher rate from drug overdoses, including methamphetamine, not only year over year, so this year compared to last year, but really higher than in the last 10 years. So we continue to monitor that, and we'll continue to work with our partners at the Department of Social Services on the prevention activities that they're conducting.
So any idea, is there a correlation between the increasing drug deaths and coronavirus? Is it just coincidental?
I think it's too early to really say. One thing we do have as an advantage this year is we are participating in the National Violent Deaths Reporting System, and so we'll have more information about certain kinds of deaths, including suicides and other things, so we'll have more of a sense of what's causing what. But I would say that, again, it's too early to say that COVID is really playing a role in those deaths.
Next question.
Yeah, Gordon Richard, Alsace Union Hudson.
Go ahead.
Dr. Clayton, last Friday, you kind of highlighted that CDC article that described kind of what took place at Smithfield. And of course, it speaks of a need for a robust mitigation and even the possibility of temporary reclosing down a facility. Are the Smithfield-like facilities in South Dakota, have you been back to those places, and how are they doing?
So a very good question, and what I would say is that, we have not seen increased cases in a lot of our meat production facilities throughout the state with the advent of the new guidance from CDC, which I say new, but it was actually end of April of this year, and so that specific guidance to meat production facilities, I think, has been very beneficial for those organizations to make sure that they're able to maintain worker health and do so while maintaining, production of our food supply. So, what I would say is that, we have not had any specific follow-up with those entities, in part because they have not had additional cases, but we do have a specific business team that helps, when there are additional questions that come up with, be it, different industry types, different business types, including meat production facilities, so that we can make sure that we're helping them decrease any risk of transmission of COVID-19, both within their business as well as to any patrons or customers.
Next question.
This is Lisa with the Argus Leader.
Go ahead, Lisa.
Have you continued to see any delay in test results from out-of-state labs?
Lisa, we are still continuing to see delay, and so and are continuing to monitor that situation. I know it's obviously it's an issue that spans states, and so I know that the federal government is actively working to try to help those companies decrease that delay as well. And so we're hopeful that that will be successful, and that in the coming days that should shorten up.
Any other questions?
Yeah, Ray from Kellerland.
Go ahead, Ray.
Hey, with the deaths, are you able to break that down in percentages by ethnicity for us? Would it correlate with the case percentages, or can you provide some more details?
Specifically around just all deaths within the state?
Well, I'm curious as to what the breakdown would be by ethnicity for death percentages. If you've broken those down into white, Hispanic, Native Americans, African Americans, blacks.
So yeah, I mean, and that is something that we do have available to provide that general breakdown. So that's something that we'll provide on Thursday's update, is to have a breakdown of deaths by race.
Oh, okay. Okay, thank you.
Mm-hmm.
Any final questions?
Deb Holland with the Black Hills Pioneer.
Go ahead, Deb.
I have a question about there's several commercial COVID testing sites at the Sturgis rally, and I'm wondering if they fall under health inspectors, if they have to be inspected by the health department.
Yeah, that's a great question. So the way, I believe you're referencing antibody testing, which shows if a person has had an infection in the past.
Correct.
Yes, so those machines are regulated at the federal level. And so any testing has to be, approved, I guess, and their method has to be proven valid to be able to offer that on a commercial basis. And so the State Department of Health does not actually regulate those testing businesses.
So even like the tattoo artists and the vendor food booths have to be inspected by health officials. These do not?
That's correct.
Okay. Can I have a follow-up question?
Go ahead.
So how will Sturgis know if there's a spike in COVID, because those people being tested are not from Meade County? I mean, they're probably from somewhere out of state. What do you have in place to let the Sturgis city officials know if it's rampant?
So, you know, as was mentioned, the testing sites that are out there, you know, are focused on antibody tests, which does not detect an active infection. Now, when individuals are tested using the molecular methods, such as PCR or looking at antigen of the COVID-19 virus, that is one where those are considered markers of active infection, and so in cases that are identified in South Dakota or among South Dakota residents will be investigated by the South Dakota Department of Health. The individuals who might be from out of state, those are investigated by their home state of residence. And when exposures occur that are you know, requiring additional follow-up by the state where the event is occurring, and for this it would be the Sturgis Rally, and so it would be the South Dakota Department of Health that would be notified by those public health agencies, by those state agencies, of individuals that have been exposed or the presence of the potential for larger spread when individuals are not able to identify all of their close contacts. So in both of those instances, we do work very closely, and we have a system in place that has been there for other infectious diseases for that interstate notification.
Okay, and you would warn the city or let the city know?
Well, that would be part of the process. If there is a public notice, then all individuals are aware. Yep.
Okay, very good.
All right, we have